this to not be the quiet space. Hello, everybody. Welcome to our today event and happy Recovery Month to everybody in recovery, allies, families, and supporters of recovery. This is a very special month for everybody who has been through substance dependence and all the families who have supported their loved ones into recovery process. And for us from the Global Gender Committee, this is really special day where we want to speak about how women actually recover, what help they get, and how can we improve the practices and services that serve women who seek recovery. My name is Mulkan Isik, and I'm representing Global Gender Committee, where I'm acting as intermittent chair. And I'm just going to share a couple of things about our Global Gender Committee. And I'm also inviting everybody to join us in the WFAD family, our global family, and to participate in all our activities that have been planned in the next month or so around women and violence against women, which is really linked to drugs and alcohol misuse. So who we are Global Gender Committee, and we are specially kind of formed to address the addiction, drug use and recovery, as well as gender-based violence in correlation with drug use and access to health care, treatment and recovery services for women. And for us,
sorry to interrupt you, but your slideshow is not showing completely.
How's that possible? Oh my gosh. I don't know what's happening, but
no problem.
Yeah, it's the connection. I'm not in my own office. So hopefully now you can see it.
Yes, now it's perfect.
Okay, perfect. And yeah, now it's not. Okay. So I just want to mention a couple of activities that we do. So we do a lot of advocacy work, and we try to kind of create the knowledge bank and capacity trainings for all of our membership that are linked to prevention, treatment, recovery, and all of the services related to women. We've been participating in creating infographics, all of the promotion materials, and present these kind of new documents to the Commission of Narcotic Drugs at the UN. We also hold webinars, we create publications, and we want to collaborate with more NGOs and networks and really to highlight that women need a special kind of approach to the needs they have, especially trauma, violence, children, and all of other kind of women-related and specific issues that are not being addressed globally. So for us, today is a very kind of special occasion that we will also showcase the film that we made, and it has been created under the network that H will talk about a little bit later. And we have established the first ever global lived experience women recovery research network. And for us, it's very important to see women in recovery as kind of allies and co-researchers in research processes, and not only as participants and someone who is just being researched. So for us, it's really a 10-year plan to focus particularly on these areas. And I will definitely not go into the details, and I invite all of you guys to visit our website and to kind of see what we do, to join us, and also to celebrate women in recovery. So I will ask Chantal now to share the video and the film that we submitted for the Recovery Film Festival. And then after that, to give the floor to H or Chantal to chair us through the meeting.
Please let me know if you can hear the sound.
Hi, my name's Tracy and I'm the author of the poem in the film that you're about to watch. But before you Back in 2023, a group of women from Sheffield participated in an international photo voice research project led by Mulke Ninsky, who is also the chair of the World Federation of Drugs Global Gender Committee. After being involved in the project, the women were fired up and decided to join forces and establish their own women's support network called SWIPE. The women jumped at the opportunity to create a film after hearing that the Recovery Street Film Festival were looking for submissions from women. As well as themselves, they also wanted to involve as many women as possible, either by participating in the filming or contributing to a montage at the end. Our call to action resonated widely, attracting women from across the UK, including Rotherham, Barnsley, Ireland, Dagenham, South Shields, Hemel Hempstead, and thanks to the World Federation Against Drugs, we also connected with women from Pakistan, the USA, and Argentina. Don't ever underestimate A Woman in Recovery is a short film created by women, for women, either in recovery or those who are sitting on the fence contemplating it. We hope you find this film as meaningful and impactful as we did in creating it. Just wanted to finish by saying a massive thank you to everybody who's been involved in this project.
They saw her through a lens of shame and proclaimed she only had herself to blame. Couldn't see the afflictions that lay behind the addiction, but this wasn't a choice. She was just another woman that lost her voice. She would smile and try to pretend that everything was okay, whilst trying to keep her addiction at bay. Some days it was hard. All her life she felt like she didn't belong. She didn't know it then, but she was wrong. She'd always wanted more, but assumed it was out of her reach. That is, until she heard another woman preach. This woman said she'd freed herself from addiction's grip on freedom's call and believed that every woman had the power to conquer all. As she spoke, quiet rebellion stirred, and for the first time in her life, the prospect of change no longer seemed absurd. Inspired by hope, she tried new and different ways to cope. She started by surrounding herself by other women who understood her plight and gave her the courage to continue to fight. She no longer felt the need to hide because she'd found her own recovery tribe. With a newfound honesty and open heart, she began to mend the ties that had once been torn apart. Her heart became a fortress, strong and true, and as every scar healed, in time her courage grew. Armed with faith as her shield and strength as her sword, it wasn't long before she began to reap her recovery rewards. Her past now serves as a rich tapestry that tells a tale of battles fought. And now she shares her own story about how a newfound strength was sought. Over time, she has slowly changed the world's view of what a strong, independent woman can do. And today, with her self-esteem and confidence intact, she stands tall. Sign to the door that any woman in recovery can conquer all.
All right, thank you so much, ladies. Thank you. That was a fantastic introduction to the session for this afternoon. Thank you, Helena. I will introduce now the next speaker for the session, and I think Milka introduced her already, which is Helena Lovell. Also lovely. Also would like to be known as H. So I would refer to as H from now on. And she is from Swipe Changing Futures. NECG, Sheffield, UK. So over to you, H, and thank you so much for that wonderful film and introduction to see all the faces of the women, because in essence, we always see stats and numbers, and now we see the faces behind those numbers. And it's always more powerful when you see the faces and the people that are affected. And so it's such a global problem. So thank you so much, H, over to you.
Thank you. Yeah, watching this film, it still gives me goosebumps. I feel extremely privileged and grateful to be part of the amazing team that has co-produced it. My own story could have been so very different if it weren't for a few lucky breaks and a bit of pester power from me. I only came to Sheffield by chance. It was the closest rehab I could get. That was in 2016. It actually feels like a lifetime ago. But maybe that's because I've put a lot of living into those years. It makes up for the lost years in active dependency on Class A substances. After rehab, I was lucky enough to stay in Sheffield in supported housing. I deliberately chose this as there was and still is a very active recovery community, a huge variety of peer support groups, activities, training opportunities, and paid roles in peer support. I've created an amazing support network, which I am very grateful for, and some real solid friendships. I met Tracy in her role as the lead of Sheffield Recovery Community, as she chairs the Sheffield Recovery Forum and is very active on social media. Tracy is very easy to talk to and extremely passionate about including everyone, hearing the service user's voice and actually doing something about it. It has never been or felt tokenistic. So let's set the scene. It's a Sunday morning and I'm having a lay-in, just drinking coffee and scrolling through social media, just chilling on my own. And my phone pings and there's a message from Tracy. Hey up, do you fancy getting involved? Then there's a flyer from Mulca, the call out for participants in the European Photo Voice research. It looked easy enough, just taking a few pics and saying what they meant to me. I also shared the link with some of my amazing besties, ladies who I knew were passionate about recovery and supporting other women. So a date was set for the Zoom meetup. That meeting was unlike any other meeting I've been on. There was something magic in that meeting. And I'm not a 12-stepper, but there was a higher power in that meeting. There was an energy, an empowered voice of women from different countries, all living in recovery, and we wanted to be part of this and do something. We wanted to shine our light so others could see us, to speak our truths loud enough for all to hear. We wanted to reach into other people's hearts and minds and give them a choice. So this started with our action, our thoughts, and our voice. I carefully considered my photos. Because I'm a few years into my recovery, I remembered where it all began, and I went back to the rehab entrance. I'm extremely grateful for being at a healthy stage of my healing journey, that I can now reflect on those emotions without feeling them and without being triggered. There was such a buzz with every new submission, with every photo and the written words attached. What a journey. It was an amazing experience. And at the end, we were lucky enough to get some funding to actually get the photos printed onto canvas and displayed at local International Women's Day events. My heart was bursting with pride and love. We had done this. We had created our exhibition of heartfelt truth, and it was beautiful. I was on a natural high for days. Then after about a week, I was like, what now? We did yoga, but the less said about that, the better. It was more creaking floorboards and giggles, a great comedy sketch. So we met up and we all felt the same. We'd come together for this research project, which was done. We wanted more. We'd created this team of friendship, this fabulous group of empowered women. We felt part of something and wanted our something to be more. We decided to give ourselves a name, and thankfully our Ruthie has brains and came up with the idea Swipe. Sheffield Women's Independent Personal Experience Recovery Network. Thankfully, other sisters on board have other skills too. My amazing friend created our logo. Another friend set up the website and the emailing links. This clearly, for me, demonstrates how women working together, supporting each other, are a real force of energy. A powerhouse of can-do energy. So, to the film, never underestimate a woman in recovery. Very aptly titled. Tracy gave us her finest writing skills, and together we made it happen. My favourite memory from the day is while we were at Rotherham, joining our sisters from their recovery community. We met up at the Recovery Cafe in the town centre. It was a beautiful day, sunny and warm, and we sat outside with our cuppers while Stuart got his camera set up. As I sat there, surrounded by my recovery sisters, hearing strangers become friends, the chatting, the laughter, the hugging, I simply sat and wallowed, soaking in the energy around me. The empowered women who had all made the same choice. My story isn't over yet. Thank you.
Brilliant. Thank you so much, H. Thank you for sharing your personal journey in recovery, firstly, and then, of course, the beautiful journey you shared with the ladies that you met up. And just how everything connects with just one connection. If somebody reaches out to you, then you take it on and then look at your journey just from that one. And I'm just so pleased that you could be here with us today to share your beautiful story and all the other ladies' stories, because not everybody would like to share the stories, so it's in such a public platform. But I really am grateful, and I think everybody in the room, including our panelists, even though we've seen the film before, it always still moves us and gives us goosebumps. In the power of togetherness, the whole of society approach where we all hold hands together. And it's very different from compared to when I started in the field about 15 years ago. Our recovery was always the biggest gap. Always, what do we do after treatment? What do we do after treatment? And that always spoke of the people on the ground being the support for each other, the peer support. So thank you so much for sharing your story. And I know you have to leave us now, but if anybody in the chat room or anybody that's listening in would like to have any questions for H, please jot them down, and then perhaps Mulke can also then convey that for her, and then we can answer your questions in that regard. So H, thank you so much for joining us today. Go well, and we will speak to each other soon. Bye, H. All right, thank you so much, colleagues and listeners. We have now our next speaker, who is from Argentina, Ms. Rocio Suarez, and she is a psychologist first and foremost, the chair of the membership and innovation of the Global Women's Network for providers of women's substance use disorder treatment and recovery, and a consultant at the University of North Carolina Women's Health Research Center. So a warm welcome, Rocio. Thank you so much for availing yourself at this time. And we are excited to hear what you're about to share with us and the network. So over to you.
Thank you, Chantal. What to say after Age and that beautiful movie? Now I'm in trouble, right? What to say now? So let me share my screen. Can you see my screen now? Great. So I want to share a story with you before that happened to me. Something that happened to me last week. I consider myself a huge learner from nature. I'm always looking for nature and looking for answers and how the world actually moves. So I was here in Argentina. It was 7:30 at night. I was reading a book and I was in my living room and only one light was on. And that light goes straight down, right? It was straight down to my sofa and I have a hair rack, a long hair rack. It was white. And all of a sudden, Julio, my cat, came running super fast to me. He was chasing a bag. It was a huge bag. And it has a light. It was lightning. It has light on its belly. He was hunting, of course. And he slapped the bag. And the bag went straight down to the rag. And the rag had long hair, right? So he got tangled into the rag. And I saw myself and him, we were both looking at the bag. And I realized that at that moment, the cat was no longer the problem from the bag. It was the rag. He was trying to survive the rag. So I said to myself, wow, I have at least two options as always in life. I can help it with the right tools, go and untangle the bag and move the bag, or make it way more difficult and do nothing. So I contemplate the scene because it was too much. And the bag starting again with the light on its belly. He wanted to fly away. He wanted to heal. He wanted to be better. He wanted to shine. So I went to the rag and just very gently moved the hairs, and he just started lightening its belly with beautiful colors, and then he just fly away, and he survived. And I just thought of this, and I said how important it is to actually help people heal, shine, and fly away. But to do that, we need to have the correct tools. And a spoiler alert, like Muka did, I'm presenting a study next week, but we now know that the vast majority of the treatment centers in the world are mixed. But they are mixed. It means they accept men and women, but this does not mean that they actually give treatment for women. They just treat women the same as men. And we have so many research that says we need to treat women with evidence-based treatment for women. So I had this huge task of saying, okay, let's go for 4 tips to treating women differently than men. And this is very dear to my heart, that is trauma. And every treatment center, every program that wants to treat women needs to be trauma receptive. What is trauma receptive? When it's receptive, it means everyone is involved. From the person, the staff that is directly treating the woman, and the cook, and the person who's cleaning. Because if we actually understand that trauma hits our biological being and hits our emotions, and if it hits our emotions, it hits our thoughts, and if it hits our thoughts, it hits our behavior and decision making. So that we need to have it super, super clear. So if we know that then it's going to interact with the treatment and the recovery itself. So we need to be trauma receptive. So I always like to give this example. Imagine that we are in a residential treatment center and a woman just wakes up at 3 in the morning and wants to go to the bathroom, right? But in the bathroom is someone that is cleaning. It's dark, it's cleaning, it's a man. And she doesn't know about it. She just opens the door and someone is cleaning in the bathroom. That itself could be a very, very triggering situation that can complicate a lot the treatment of that person. And it could trigger a lot of symptoms and signs that the person that is cleaning may not know how to solve. Imagine that we actually do a trauma receptive and we go to the number 2, that is safe environments. Treatment should be safe. So how can we make something safe with procedures? So let's go back to example. When a woman comes to our treatment, we give clear procedures. We give predictability. They need predictability. We all need predictability, but they are traumatized. So everything is unexpected in their life. So if we say, look, we have a shift for cleaning and at 3 a.m., the bathroom will be cleaning. So if you need to go to the bathroom, you will go and you will see a sign on the door that says someone is cleaning. If you want to go inside, you just knock on the door. The person will go out and you get in. And just when you go out, the person will get in again. That alone seems nothing, but that's a procedure. And that means that you are taken care of, that you are understood. Because if someone takes the time to understand what is happening to you, it means that someone cares. And that would be great because you know what's going to happen. You are safe in your place. The third one is empowering. Again, these amazing women have been traumatized and they feel this big, like this little, because they feel they have no control over basically anything, not over their drug use, over their trauma, over their thoughts, their emotion. So what we need is to give them the chance to make agreements, them to be an active part of the treatment. How? Well, for example, when we give the treatment plan, we always ask, do you agree? It's simple, but it's not often done. Do you agree with this? Can you do this? What do you think about the schedule, the times? And we will have a feedback from them. And then we can actually make the treatment plan with them. That will make that they will be much more committed to the treatment itself and feel safe. And the fourth is, I think, is my word of the year, that is consistent. Everything should be consistent. So we need to do what we say we're going to do, always, because that's a way of building trust with our colleagues, with our partners, with our family, with our patients or clients. So this happens very often. For example, you screen for PTSD, okay? That is not very done, but we should do that, screen for PTSD. And then we screen positive, we assess the PTSD. But if we know we have a patient or a client that has PTSD, we need to treat that PTSD. We cannot say, okay, we know you have PTSD, but we cannot treat it. So if we don't know how to treat it, we don't have the resources, it's very good if we find networks that actually help us treat that PTSD, because we need to be consistent, we need resources, we need networks. So those are the 4 tips, but I don't want to leave this webinar saying that as the women need these resources, this feeling safe, this being consistent, this having a network, we as providers, as policymakers, we need that too. And that is why we created the Global Women's Network. So for those who doesn't know about it, we launched this year in June, and we have more than 2,200 members already. So this speaks very, very loud. It means we really need to connect. And what do we do here? We are there for each other. So we have people from more than 90 countries in the world. So what do? We have, for free, of course, practical knowledge programs. So we get together once a month in a digital platform, and we give, like this, 5 tips for you to use on your practice every day. Easy tips. But then the last 15 or 20 minutes, we have a discussion where someone from India says, I have a problem, how can I solve it? And maybe someone from Bolivia said, you know what, I've been through that and we did this. And that is very rich. So the network keeps growing. We also give resources on the webpage, that is that one that is there, because I've heard many times that says, I want to screen for example, trauma, but I don't know what tool to use. What should I do? How can I use it? How do I use it? So there you can have it. And third, we have what is called a technical assistant program. Because we know that there are many treatment centers in the world and programs that need assistance, that they need specific assistance with how to actually do a mixed treatment center, procedures, screening, assessments, anything. You can name it, you can read about it, and you can put it. But an advice, if you're gonna actually ask for technical assistance, be as clear as possible. So we can read that, it goes to the board and it gets analyzed. And then maybe you get chosen and we do some hybrid or online or in-person assistance for you. So I'm sure I'm gonna get much more from this webinar that I'm giving for you, but well, these are my tips. So thank you very much.
Thank you so much, Rocio.
I can't hear you, Chantal.
Oh, that's strange. Oh,
Now, yes.
The fine. Okay. Thank you so much, Rocio. I really, wow, that I even learned something new now as well. And this is why I love webinars and networking. And it's like you said, Rocio, we need to connect, and we're a global support network for each other. I think that literally stood out for me. And, you know, all the things that you spoke of really speaks to what our inpatient treatment centers really need to take on board. You know, it's again, it is a co-ed or male and female inpatient treatment centers here by us. But I think it's like you said, women are unique. We need to make the differentiation within the inpatients as well. And you've really provided some great tools, as well as, you know, the network opportunities, the Global Women's Network that you launched in June in Greece. And, you know, I think most of us were there, but it really was special. And I really just wish you all the best. And we will do everything in my power from this side to also just advocate and assist, because like you, Rocio, I work a lot with the stakeholders that are on the ground, that are doing the interventions, and they need the support. So all of that you just shown us, it really will go help those on the ground. So I really thank you for sharing the information and being able to attend the webinar. All right, so we're going to have our questions and answers for Rocio later. Please jot them down, and then we can obviously ask afterwards at the end of the webinar. And with no further ado, we'll introduce Asia Ashraf from Pakistan. She holds a master's in applied psychology, and she also has a diploma in HR management and speech and language therapy from Islamabad. And she did 1-year fellowship in substance abuse education, treatment policy and prevention from Virginia Commonwealth University. She's a national trainer of the Universal Treatment Curriculums, UTC, for the UNODC and Colombo Plan, and is internationally certified as an addiction professional at ICAP from ICC. Yeah. So, Asia, over to you. Thank you so much for being here as well. But if you have a presentation, you're more than welcome to show it as well. So thank you, Asya. Over to you.
Thank you very much. Thank you very much. And good day, ladies and gentlemen. If there are participants in the, if the men are participants. So it was very nice presentation from Rocio. So I'll be talking more about today, bridging the gaps and how we can foster evidence-based treatment and recovery for women with substance use disorder. And next, and because you all know that I am from Pakistan, and Pakistan is situated in South Asia. And next, and I will not go into the long details. I will just give you a very, very short background of how the female drug abuse situation is in the country. So Pakistan is situated in South Asia. And we, because of the geographical location, we are both a transit corridor as well as consumer of illicit Afghan drugs. So the drug abuse is like every part of the world. It's a huge pandemic in Pakistan. Next, please. So I have shared that because of the transit corridors, how the current status is like that. We do not have any updated data. We have mostly the previous records. That was the data that was conducted by the women in UNODC in 2013. And as per that data, there are only 1.5 million illicit drug users who are women in the population of around 7 million illicit drug users. And which we understand that it is underreported, under-researched, and understudied. Can you, Cressida, can you turn on the slides? And I have told that. Next. So we all know that currently ICE is a huge pandemic in Pakistan. It is just like once there was an heroin pandemic, it's like now like ICE is a pandemic, and it unfortunately it is mostly abused by young girls and boys and young women in the educational institute in Pakistan. You can, I have just gathered few screenshots. Next, please. They can show you like how it is a pandemic in my country and how it is affecting young girls and the women. Next. And you can see that almost 75% of the females, they're using ICE or meth in universities in Pakistan. It was reported by our ex-narcotics minister. Next, please. And most commonly in the survey, the common drugs, they were more amphetamines or tranquilizers or sedatives. But ICE is like a huge pandemic. And in a country where there is only 30,000 people in a year could get treatment, and there is no gender or female specific facility at all. As Rocio was mentioning, if there are few facilities, they are mostly the mixed gender treatment. Definitely, they do not cater the needs of the women. Next. And I will not go into the details of like why women are using drugs. The factors, they are more or less similar like any other country in the world. There are psychological factors. They're like unresolved conflicts with their husbands, economic factors, because women are having a dual responsibilities, like they have to play the role of a caretaker, and now they have to support the family as economically as well. And there are a lot of other social factors. There are no recreational activities for the women. There are a lot of stigmas. They're like they're not allowed to talk, to share. There is a lot of trauma. There is a lot of gender-based violence. Unfortunately, in the current years, the gender-based violence in Pakistan, it has been increased among 50%. And Cressida, you can move the slides. I have discussed that, and I just wanted to focus more on next. And we all know the relationship between trauma and addiction. And Rocio thus mentioned that how important is we need to cater. We as a treatment provider, we need to be both trauma responsive, and we need to be trained in trauma care approaches as well. Next. So what next, please? So I'll be focusing more on next. Like I got an opportunity to attend the training of a voice curriculum. That is a specific curriculum which caters the needs of the women. I got an opportunity to attend that training as a trainer. And in addition to that, I was able to get a training of trainers in recovery, LAs, and another curriculum which is called as SOGI, that is sexual orientation and gender identity disorders. So what we learned from that curriculums, especially WISE, and how it is helping us to provide better evidence-based treatment and recovery-oriented care in the Greenfield Hospital of Psychiatry. I would focus more on that. Next, please, Sita. Next, please, because I'll be focusing more on the approaches, yes. The first thing is next, please. The first is like, that is what the Rocio was mentioning, that the safe place, that the environment. In those curriculums, I learned that we need to create an environment for the women that is safe, that is like where the treatment is ethical, where the treatment is humane, where the focus is more on culturally sensitive nature, where the treatment is more gender specific focus, where we consider like the rights and privacy of the women. It is very much important. Next, so the core essence of that curriculum, WISE and all other curriculum, is like we need to create an environment that focus healing. So there should be a safety, there should be a mutuality, and there should be a empowerment. And then Rocio has specifically talked about that, how important is to have for the women, the environment should be safe, how should be that it is like recovery oriented, recovery conducive, and how it should be focused on and strength based approaches. And next, Cressida. Next, please. Next slide. And second, first was like in the environment. Second was like, we found that the outreach services, they were really helpful. We were really reaching out to the women. We were definitely responsive to their needs. We were more empathetic. We were addressing their immediate concerns. And we were like, we were able to connect with the women with the different resources who could be of helpful. That was the second thing. That was the second key takeaway from the curriculum, which we implemented, and it is really helping us. Next, Presida. And third important is like, we are working on the continuum of care, that we start from the pre-treatment, like reaching out to the women, providing them treatment, like individual counseling, addressing all their needs. It is trauma responsive approach, and most importantly, that it is also the treatment is addressing the comorbidities, both physical or psychological or psychiatric comorbidities. Then we had case management, that is like because women have a complex needs, and we found that case management is really useful. And most importantly, we started focusing on having a ongoing recovery management. And in that recovery management, so the continuum of care is really helping. So that is the third main thing that we got from that curriculum or that training. Next, Cressida. And how we are able to do that? We are able to that because of the supportive environment, because we replace the confrontational approaches that they are very, very, very much common, unfortunately, in my country, with the more motivational approaches. And we really found that without a qualified and trained professionals, it is not easy to achieve those objectives. So I got trained in those curriculums, and then I started training my team, and also I'm training the other addiction professionals in my country. And also I would really like to use that platform. And if there is like Rocio, if you need any technical assistance, if I could be of any help to train other women around the globe, I am there. So Cressida, next, please. And these are the two curriculums which really help us, like Women's Intervention for Substance Exposure, Comprehensive Care for Substance Use Disorder, which is called WISE. And I also took some help from the SOGI curriculum, that is about the intersection of the substance use and sexual orientation and gender identity, and also the recovery curriculums, recovery LA's curriculum, that really helped me. Next, please, Ida. And most important tip or the practical tool, which is really very helpful, that is the concept of mutual support. That is the concept of peer support. That is the concept of recovery lounge. We provide open, free, safe space to the women who are in recovery. They can come anytime and they can talk to each other over a cup of tea or coffee. They paint, they create, like they share their stories. Then we provided them with this safe space, like where they can express whatever they are going through, and they can share their challenges, they can celebrate their successes. So that idea of recovery lounge, which is basically an idea of mutual help, that is really helpful. Next. And definitely women who are not able to get in-person help, we are providing them remote counseling over the platform of PSIN. And next. And we are doing a lot of advocacy, Cressida, you can turn on the slides, like, yeah, move on. And we are doing local advocacy, and we are also doing global advocacy. Next, please. And that is how we are going global advocacy, Cressida. Next. I'm sorry, that is an old picture of our network from Global Gender Committee. I know that other members has joined us, like Russia, Sadaf. Apologies, that is an old picture. I have used it because of the short of the time. So next slide. I'm concluding my presentation that what we learned and what is really helpful from our experience. I'm going to conclude that women need a treatment that is gender responsive, that is culturally sensitive, that is trauma responsive, that is strength based, and that caters the multiple needs of the women. And that is really helping us. Cressida, if you could click, they can, yes. That is the core of the treatment, which is really helping us. Thank you very much.
You're not audible, Chantal. I
Yeah.
don't... Sometimes your microphone seems to shut off, even though you're unmuted. Try again.
Yeah, Raja.
Nothing. No.
Can you speak louder, maybe, Chantal? We no. No.
It's slowly coming back.
Yeah. Yeah.
It's very far a distant sound. Yeah, a little bit. No, it's very distant. Okay. Otherwise, I guess we would have to, Mulka or me has to take over. Do you have the moderation, Mulka? No? Okay.
I don't. Okay, thank you, Asia. We can just maybe try to resolve it by taking the floor back to Sadaf now. And Sadaf, you can tell us a little bit about yourself and go on with the presentation. Thank you so much for joining us.
Okay, thank you very much. So I am sharing my presentation more. take it longer. Can you hear me, by the way?
Yes, we can.
Perfect.
Okay, yeah, perfect. So if I start, like, I'm Sefer Engin Osmanoğlu, currently serve as the International Cooperation Manager at the Turkish Green Crescent Society, and happy to be part of like the WFAD Gender Working Group also for like almost like 2 years right now, as far as I remember correctly. And today I will be discussing our gender-specific approaches and the best practices for supporting women in recovery with a focus on the work we are doing at Green Crescent Counseling Centers. And these centers play a crucial role in addressing addiction through the tailored interventions and holistic support, let's say. And then, like, we are quite an old NGO established in 1920, but many of you already know about the Turkish Green Crescent Society, so I won't go into detail, but we'll be focused on more like the gender-specific approaches and the models and the recovery things. So, like, but for example, firstly, I will tell a little bit about our counseling centers. Green Crescent currently operates 107 counseling centers called YEDAM across all 81 provinces of Turkey and in Cyprus. These centers offer outpatient counseling services to individuals struggling with various forms of addiction. Each center is designed to provide personalized care that supports long-term recovery, emphasizing the family involvement, individual and group therapy, and social reintegration efforts. Our rehabilitation model is based on extensive research and collaboration with experts worldwide. After reviewing the best practices from the 10 countries, we adapted 5 models to see Turkish cultural norms. This localized approach ensures our services are culturally relevant, integrating family support as a core component of the treatment process. Each individual's progress is closely monitored and supported through comprehensive intervention strategies. And our YEDAM model integrates individual, group, and family therapies. The involvement of the family is crucial. It reflects our cultural understanding of recovery, where family members play a pivotal role. We utilize evidence-based techniques like motivational interviewing, cognitive behavioral therapy, and mindfulness, which are complemented by structured case management system through our YEDAM software, ensuring that each client's progress is closely tracked. So our counseling centers all over the country and in Cyprus, and each psychologist going through trainings and supervisions like motivational interviewing, CBT and mindfulness, and also crisis management and emergency procedures also. Each counseling procedure is well structured for clients and professionals. A client's arrival at the center from the time of the call, and all her activities are recorded, and all her developments are monitored through a software which we call YEDAM Soft. And some examples from like this centers also. They have a unique structure in terms of outside, but inside they share the same kind of like the infrastructure, which is kind of like ruled by the Ministry of Health also. And our rehabilitation centers fills a critical gap in Turkey's treatment landscape, particularly in addressing detoxification and inpatient rehabilitation needs. Our model blends universal therapeutic community approaches with Turkish cultural norms, particularly recognizing the importance of family and community support in the recovery process. These centers offer a structured, holistic environment for individuals requiring long-term residential care. The core of our rehabilitation model is the family-centered approach, which leverages the strength of the family support in the recovery process. We also emphasize the community-based services, reducing stigma and promoting reintegration into society. The holistic approach addresses not just addiction, but also the psychological, social, and spiritual needs of each individual, ensuring a well-rounded recovery process. And our centers provide a diverse range of activities designed to support different aspects of well-being. This includes group workshops that help individuals develop communication skills and self-esteem, outdoor activities that reduce stress, and leisure activities that promote health, hobbies, and interests. We also encourage reading, which fosters personal growth, provides individuals with new perspectives and coping strategies. And some like treatment recovery for diverse groups, and I will especially focus on women issues here. One of our key initiatives in our women-specific recovery guide, which is designed to address the unique challenges that women face in addiction recovery. This guide takes into account societal expectations, gender roles, and trauma. It emphasizes the personalized intervention strategies that are sensitive to women's lived experiences and ensures that both women and their families are adequately supported throughout the recovery process. And the Women's Sharing Group offers a semi-structured environment where women can safely share their experiences. This group help foster connection and emotional regulation, and participants focus on key topics like relationship dynamics and communication skills. We also provide additional support services beyond group meetings, ensuring that women receive a holistic approach to recovery that addresses all aspects of their lives. And the chart also represents the total number of applications to a counseling center over 4 years, comparing men blue line and women red line from 2021 to 2024. The chart represents the total number of applications to a counseling centers, like, yeah, the same. And the gender disparity is substantial, with men's applications ranging between 3.5 to 5 times higher than women over the observed years. And then again, some because we are not only working on substance addictions, but we are also working on the behavioral addictions. You see some gambling kind of data also here, and alcohol, tobacco as well. And then in Turkey, I will also share the reasons behind a bit here also. Traditional gender roles significantly impact women's experiences with addiction and recovery also. Women often face increased shame and isolation because of the societal expectations tied to motherhood and fertility. These roles can also deter women from seeking help, and as they fear judgment from their families and communities, one of the most critical challenges is the fear of losing custody of their children, which is a major barrier to accessing treatment, unfortunately. And women struggling with addiction face multiple layers of stigma and shame, often being labeled as bad mothers or weak. This internalized stigma can further lower their self-esteem and worsen their mental health. And additionally, women dealing with addiction are more likely to experience violence and abuse, which creates trauma and increases their risks of relapse. It is essential that our recovery services address these unique challenges and provide women with support they need. And this is because of this reason also, to raise awareness and international advocacy also, we introduced our Women's Forum on Addiction and Recovery. The first one was the hold at national level and online in 2022. In 2023, it didn't happen because of the earthquake just hitting the southern east part of the Turkey. But in 2024, we had an international event at the same time with the CSW also. So on March 14, 2024, we hosted the first international forum on the addiction and the recovery in women in partnership with the institutions like the Harvard University, EMCDDA. And the forum brought together experts and advocates to address the unique challenges women face in addiction and recovery, including access to services, double stigma, and domestic violence. Supported by the Ministry of Family and Social Services, although the minister herself addressed the critical connections between drug use, trauma, and violence, and highlighting the need for comprehensive solutions. And our aim was to strengthen the global support and network for women and recovery also. So, like more or less what we are doing like as part of like the Turkish Green Crescent is like this in terms of women. I hope it will be increased, and also like as the gender working group also we are kind of like happy to support the women's recovery systems and advocacy collaboration just to improve the situation of women everywhere. Thank you very much.
I think I'm not sure if I can be heard. Nothing.
Yes.
Yes, we
Yes,
hear you.
Wow.
perfect.
Great. I was getting a bit worried there. Asia, thank you so much, first and foremost, as well, for your presentation. I wanted to mention a couple of things and linking up to Rosia's presentation as well. And then, of course, Sedef, thank you for your presentation. It's always great to see everybody what they're doing. When you work so closely together with the ladies on other platforms, it's really lovely to see what you're all doing day to day on your daily basis. So thank you so much, Seda, for your presentation. I just like to highlight how important networking and connection and working together with different stakeholders is really, it's key. And Seda's presentation really highlighted that as well. It's a multi-sectorial approach. So different people need to come together in order to provide women with evidence-based treatment as well, starting from policy, legislation, your federal government, your national government, from the top right through to the provincials, to the provinces, and to the local municipalities. And then, of course, the inpatient treatment centers, the community-based organizations, the referral pathway, etc. So, in my day-to-day job, it's exactly who I work with is stakeholders like CDF and Asia and Rocio and Mulka here in our country, because we understand as a policymaker, as a policy implementer myself, you need to work with all the, stakeholders together. So we need to also raise awareness of those, the programs that CEDAW offers, for example, in their country. Advocacy work is what Mulka mentioned before. So it really is a constant, constant sharing information, the networks that Rocio is involved in. That creates really the platform for us as professionals to come together, whether you're on policy, whether you're in treatment, in clinical settings like Asia, and whether you're not in recovery, which is the ladies that spoke earlier, like H. Their voices are so critical. And for us as policymakers and clinicians to understand what their needs are, because as we know, every person is different. Hence, in social work, we call it individual development plan. And that always speaks to the individual and their circumstances and what there is to offer for them on the ground. Because as governments, they are responsible to put these things in place for our communities to access, and they need to work with organizations like yourselves, and I'm sure the listeners as well. So I always encourage and advocate for that as well. Work with your municipalities, work with your governments, work with your NGOs. And once you understand that approach, it's what we call a developmental approach and a whole of society approach. So I just really want to say thank you to all the panelists, all the speakers, especially for the brave ladies that come and tell their journey and their story. They are the brave ones. They don't have to do what they do, but they are doing it because they feel what an impact it had on their lives when they started connecting with the right, with their peers, with the people that have gone through it. And as we know, in substance use recovery, relapse is also obviously part of the journey. And when you have that safe space where you can go to and you're not going to be judged, you're not going to be, treated as another number going through a treatment center. I think that has more impact than having to think, I have to now go back to an inpatient treatment center. So that recovery support professional allies I reckon is going to be very critical in how we come together as networks globally to reduce the demand for drug use and alcohol use in our communities and yeah, everywhere really, isn't it? So without further ado, I think we've come to the end of the program. We also would like to highlight that you have the opportunity to have the questions now, the Q&A for the panelists. We are fortunate enough that everybody can still stick around. So therefore, colleagues on the online, I think we had a couple of questions for, is it first for Rocio, Cressida, or is it for, are we going to go per panel, panelists, or are we going to just do a general Q&A?
I think there are some questions directed to some of the speakers. So, but you can ask the question, and then if anyone has also something to add, then feel free. Anyone can feel free to add.
Sure. So shall we start off with the second question in the Q&A, gender role expectations in developing country highly influences women seeking help behavior due to the cultural stigmatization of women with substance use disorder. In this case, so here's the question, how can we increase the awareness and knowledge level of women and bring them to the treatment programs? So that's the one question, ladies. Would you like me to repeat it, or would any clinician like Asia or Rocio, would you like to go ahead, or Sedef?
Sure, thank you. That was a great question, and this made me think about access to treatment. I think we're going to talk about this in another webinar, but I want to say something about this. So we actually did a study with the World Federation Against Drugs that it was published this year, especially in the Caribbean. So there's very little access, online access to treatment programs. And if we go to what we said in this webinar with these amazing colleagues, we all talk about stigma, being afraid. So we actually women need ways to access programs that are private, quick, and they can do it with their phone. So the best thing to do is actually to be present online and give all the most important information, like do you give gender responsive? Do you actually give service to children if you're pregnant or if you have little children? What do we do? The cost of the treatment, how to contact in a private way the treatment center, because they're not going to come and just knock on the door. That's not usually what happens. So a tip I can give that I'm sure we will talk more about this is online, being online.
Sure. No, 100%, Rocio. Thank you so much for highlighting that. And of course, that is also anonymity, so you can be anonymous, I suppose, if you reach out for help online as well. You know, because that is really a big barrier, is access to treatment. But I also found where there is treatment available, I find it's very much the motivation to go to treatment, I suppose, and the awareness as to where there is treatment. Because, you know, some of our centers, for example, have been running for decades, yet people still don't know where to access treatment, you see. So it's constantly just making the public aware, making the communities aware. And that's why it's critical to work from the ground up. So thank you, Rossi, for that contribution. Asia, would you like to contribute as well?
Yeah.
Thank you.
Just the one point, I agree with the Rocio. It is very much because I'm coming from a culture where it is like highly stigmatized for women to get treatment. In the start, they were telling the families, oh, we are going to the tailor, we're going to the market, and they were like just running and down the like they were coming to me and they were seeking help. So it is really hard. What we have done is like that outreach, reaching out to them who are in need. That is really helping, like going to the educational institutions, like involving GPs, gynecologists, primary care healthcare physician. That is really helpful. And also, like in my culture, having more of a trained female staff, like female clinical psychologist, female doctor, a female case manager, a female caretaker. So it is really helpful, like for the family to trust us and like for the women to trust us and to get the treatment. So these were the two things like which came into my mind.
100%. Thank you for that. That's also very much like you always say, the cultural awareness sensitivity is really important. You're quite right. Sedith?
I can also add that like we are trying to achieve a kind of confidence with the women also. For example, like the drug use is illegal in Turkey, but like we have like the kind of like the privacy agreement with our patients, so no data is shared with no one, so people can trust and attend. And then like there are like the women specific approach because we know their role, societal expectations also, and like the expert psychologists just make their interview and then they share their recovery model, all kind of treatment expectations also. And then I would like to maybe add that we provide services. We don't provide any kind of medication, by the way. All services like provided free of charge, so they don't need to pay anything. So it's kind of release also kind of people right now, especially if they are not working, not have enough money to support their recovery process also. So it is well adjusted, but others wise some hospitals like there are dedicated hospitals in Turkey under the Ministry of Health also supporting them with medication kind of treatment also detoxification process. We are always suggesting to policymakers like most of the story behind like the women with drug use disorder is with violence, trauma associated in our cases, mostly because of men. So you should create kind of like the safe environment for them to feel them safe to achieve through recovery. And if they are a mother with kids, they could come and stay. And there are some models also already. There are not many there, but there are kind of pilot applications also. Women with drug use or like the substance use disorder can stay with their kids in this like the dedicated centers.
Great. Yeah, thank you, Sarah, for that input. Because like you said, it would be different for different countries, of course, but I think it's safe to say that we have to create those spaces so that they can access the treatment that they rightfully deserve. Sedith, there's a third question for you directly here. Great work you're doing. Please shed light on life course approach and industry targets as recovery issues. That's the question.
Okay, if I understood correctly, I will also share a bit about like the industry targeting the women. For example, I have kind of like the data, especially like the alcohol industry targeting the women for in Turkey, for example, and then like they are just like there are some like the they cannot share the public ads, but through the social media, other channels, they just serve the alcohol as a kind of drink and a thing for like the women with good education and with certain kind of like the salary or something like the gender specific issues. Also, we are kind of getting like the people warning about them making advocacy to be more careful and more things, and then maybe different organizations and WHO also we are kind of working on like the alcohol labeling, for example. We have quite good in terms of labeling and the taxes in terms of alcohol, but there are some still items missing on like the alcohol bottles. They say like for example, like alcohol causes cancer or sometimes this kind of issues, still like the calories also. And then it's growing issue also, industrial related issues also, online gaming and gambling, and sometimes go together with like the drug use disorder also. There are like the kind of like the things like the especially targeting from industry to women as well also to feel them more kind of powerful and making money or something. So yeah, we have to like to improve like the gender specific advocacy and then raising awareness campaigns and everything also for these issues. If this is the correct answer for the question, this is, and if he or she is like they asking different things, I can try to answer also.
Great. Thank you so much, Dedef. I think you answered it. How are you able to run these programs? Are the services paid for? So you definitely answered that section. Thank you. So I have one last question for Asia, I think. We've got about 10 minutes, I think, to the webinar ending. So we can definitely take some more questions, ladies and gentlemen. Asia, great and informative. Thank you. How are you able, sorry, that was for Asia, actually. So sorry. So that one you can also answer, Asia. I think it's for directed at your programs. Like, how do you pay? Are you able to service? Who pays for your programs and who can access it? Is it funded by government, for example? Are you part of, yeah. Over to you, Asia. Thanks.
Thank you very much. The place where I'm working right now, that is the Greenfield Hospital of Psychiatry. It's a private setup. So it's like paid by the patients and their families. But the initiatives which I have taken, like within the hospital, like the idea of recovery club and recovery lounge, that is like it seems like it requires a lot of money. But when I started there, I just needed some place inside the hospital, because like idea of recovery club, it was started basically in my previous organization, which is a charitable organization. So what I needed in that organization, just a space, a little space where the women can sit and they can just talk, a cup of like tea, or like where they can just sit, and then the program staff is voluntarily available. When I started Recovery Club, which is now has turned converted into Recovery Lounge, it was this like after a week, when the women or the people who were in the recovery, they were involved. Some were bringing cookies, some were bringing like something to eat, and they were just like this. So it started something like more of a self-sponsored or like self-fund, like, you know, it was not a cost on the even organization. They were like, some they were bringing the juice, and they were bringing the candies or something like that. So the core idea of like recovery club or recovery lounge, it is just like within that facility, even if the patients who are not like affording, they can part of that recovery lounge, and we can definitely support them. So this is like you need to have a like a small initiatives with not much of the cost involved, but the benefit is like just big. So some of the women, if they can bring the painting, they can bring the colors, and sometimes we provide them the colors, and they can come and they can paint, and they can just like some of the women who are good into the calligraphy, something like that. So in that initiative, the smaller initiative of promoting recovery, they are very cost effective. We do not need to invest a lot of the money on them.
Great. I love that. I really love that concept in your approach, because as developing countries, because I'm also part, you know, in a developing country where money and budget is always an issue, you know, and we only get funded for X amount of bed spaces at one inpatient, like 150 clients can, you know, that is funded for them. But then what happens to the others that can't afford? And, you know, it's like you say, you start being innovative as to what you can offer, and you start the recovery lounge concept. I love that. I just absolutely love that concept, as well as what H said about the recovery tribe. I think it's so critical and important for us to start using this language, because it really kind of unifies everybody on this journey of recovery. And, you know, we don't feel alone. Like, and I think I remember when I started in this field, you always felt like, wow, how do people actually go into recovery? What do they do afterwards? There was nothing in place. And this recovery lounge, Asia, is really a key concept, which also gives the person in recovery and the community the ability to take ownership. You know, and it's like the NA does it as well. They are great in our, you know, in our side, this side, where they actually are helping our stakeholders on the ground how to set up support groups to drive the NA program. So now what I will say, the recovery lounge concept is brilliant. It really gives that positive reinforcement of a safe space. So well done. as well as H for that recovery tribe. I'm really going to steal all this lingo from you guys now. I'm going to take it on board. Thank you, ladies, panelists, everybody for being here. I think we have 5 more minutes, but if anybody else from the panelists would like their last comments, Mulka, we can start off with you. Then, of course, Rocio, then Asia, then Sedef.
Thank you so much, Chantal. And I just want to again repeat that I'm really proud of all of these women in recovery and all of the service workers, service providers, and us also in policy and advocacy work. This is a really significant month for everybody in recovery, and supporting women, making their voices heard, and also providing the technical support and research in this area is critical for the change to take place as soon as possible. We see every day that so many women are left without treatment. They're separated from their children, and they're victims of gender-based and partner-based violence and suffering in silence. So for me, this is very important to give them their voices, to spread the knowledge about what needs to be done, what works, what doesn't work, and to share all of these inspiring lived experience stories is the key for any change. So I just want to thank again everybody for their presentations and the time, and especially those who attended this event. Thank you.
Thank you, Mulka. Thank you so much for your words. Thank you. So then we can move on to Rocio, please. Thank you.
No, nothing. Just thank you, everyone. It was amazing. And just going back to the story, we have all been into dark places in one moment of our life. It doesn't have to do with substance use disorder. Any moment, we all have dark moments, and we can all, with the right help, we can all shine and fly. So yes, that's what I'm taking from here.
Thank you, Rocio. Beautiful end of short but sweet message. Thank you. Okay, Asia, over to you.
Yeah, thank you very much. It is just like always a proud moment, and talking about the recovery, listening to the stories and the video. It was just like you feel so good at the heart, and you feel so good like you are linked with a profession that is a passion, and that is like it is just like you have an energy, and you are able to connect and see. And I always believe that it takes someone strong to make someone strong. So we are strength of each other. We are in different part of the world, but we are supporting each other. We're smiling, we're supporting, we're caring, we're appreciating, and we are just re-energizing. So it is just not a recovery month. It's just like every day it is happening. So thank you very much for giving me this opportunity. I'm so honored to be part of this beautiful community.
Thank you, Asia. Beautiful. Thank you so much also for that lovely words. All right, panelists and colleagues online, I think this is the end of our webinar. If you have any further questions, please don't hesitate to email it or write to Cressida or Mulka or any of the panelists. I think we can do just information sharing if that's possible after the webinar. And I just would like to say again, to thank Mulka, Amy, Chantal, Drug Free for also making this happen. WFAD as well for making this happen. Without our global partners like yourselves, we wouldn't be able to do this ourselves as well. So your support is critical to this. So thank you so much from our side to support such webinars, important webinars. And, even if we touch one life, that is our purpose, isn't it? And empowering one more life. That is all what we're trying to do here. So thank you, Amy and Chantal, for supporting us during this webinar. We really appreciate it. And then hopefully we can do some more in the near future. Thank you, colleagues. Bye. Have an awesome day further, and see you on Monday.
Bye-bye.
Bye. Bye.